Good afternoon to one and all. Post-lunch sessions can sometimes bring a little drowsiness and our minds often goes into Shavasana mode. But don't worry, I assure you all, the speakers lined up now will help us and keep us wide awake with their knowledge of Ayurveda and clinical insights about emergency management. It is our great pleasure to introduce our next speaker for this session, respected Dr. Rishi Mannivaran sir. Sir belongs to 48th generation Putru Maharshi Siddha lineage. Sir is currently working as the Director of Medico-Social and Indigenous Knowledge Center at Garden of Peace, Vellore. Sir, may I request you to kindly come on the stage, and I request respected Nitin Thatte sir to kindly felicitate Dr. Rishi Mannivaran sir. To give a brief introduction, Rishi sir holds an expertise in Ayurveda as well as Siddha. Sir is being felicitated with a shawl, shrifar, memento, bouquet, honorarium, seed ball, thank you card, and the Hindi book written by respected Vaidya R.B. Gogate sir. This is our token of deep respect and gratitude for Sir's valuable presence and contribution towards Ayurveda. We are honored to welcome Dr. Rishi sir. Sir has completed his formal graduation in Ayurveda and masters in Chinese medicine. Sir has successfully treated patients implementing the traditional knowledge of Ayurveda and advanced Siddha techniques. Currently, Sir is working at Vellore. Sir has published extensive research work in Ayurveda journals. Sir is an editorial assistant for the Science of Life journal. Sir is working on translational research in biophysics, bioenergetics of Ayurveda and Siddha. Sir has delivered lectures to many Ayurveda and Siddha institutes along with few bioscience institutes. Sir is a young dynamic Ayurveda practitioner. We are truly honored to have you in this national seminar, sir. Sir, may I request you to kindly share your perspective on multi-spectrum approach in emergency management and guide us further with your valuable thoughts. Thank you.
Thank you very much. So first of all, it's for me it's a very big honor to be in this place, Pune first of all, because it's almost an 8-year dream of mine to visit this town. I mean, now it's a city, and because this for me is one of the most crucial crux points of Ayurvedic innovation. And as you all know, we are all, we have everyone from various parts of India. And Ayurveda isn't just a science, which is just on the text. It's something that always evolves and adapts according to age, era, and the situation around you. And, there are very few such focal points. And for me, Pune has always been one such point where true innovation and adaptation of the principles of Ayurveda has happened. And that has made it more relevant to the society and community as well. So that is my first pride point. And also to be here, hosted by this institute of the Gogate Foundation. Because I'm a big fan of Gogate sir and his work. Because it's pioneering. Because like I said, you take a small bit, and that's the beauty of our Shastra. That you can just take one word out of it and you can create a huge compendium or an encyclopedia on your own, provided you have really understood what it is. And that's what he has in fact done with this science. So I'm really honored to be here and being hosted by this particular institute. And having said all that, we'll get into the subject now. So I will be going through a different spectrum of sciences. But I want you all to know that I'm an Ayurvedic graduate, and whatever I might be talking about in the terms of Varma or be it Siddha, Savarikpa, I consider Ayurveda as a big umbrella which encompasses all of these sciences. And our Samhitas are designed in such a way that, it's a guidebook. These are not textbooks. There's a difference between a guidebook and a textbook. A guidebook merely guides you. and it's up to the learner or the seeker to then go and develop that knowledge further. So for me, it was a curiosity then, which Ayurveda guided me through, and that led me to go and explore other sciences and illuminate different aspects of what was hidden in our Shastras. So whatever we're going to go through, for me, it's all Ayurveda, though it might seem like different sciences. And I also just wanted to mention that I had sent a video, and I hope that was shared, because that gives an introduction regarding the foundation or the basics, because considering the time limit here, I'll be jumping more into the pathology and the intervention methods than focusing on the basics again. So first and foremost, salutations to the Mahasiddhas, and this is Sri Putru Maharishi, who is the Adi Guru, the first Guru in our lineage of the Vaidyas, the Siddha Vaidyas that my Guru taught me from. And these are the 18 Siddhas who created the foundation of all the sciences, the Indic sciences that we call today, beginning from Agastya. And my humble prostrations to both my Gurus, my Siddha Guru and my Ayurvedic Guru. Now getting into the subject. What makes Ayurveda really unique and perplexing is that it might all seem like mumbo jumbo. In fact, when I was studying Ayurveda and I had a few colleagues from the allopathic stream, they would go through the textbook Ashtanga Hridaya and they would find out, especially in Rognutpadaniyam, they would say that blocking flatus causes these diseases, and they would laugh at it. And they used to make a mockery out of it, and back then I didn't really have an answer to it. I had to just keep quiet and keep mum. But the beauty of our sciences is that these are all codifications, these are all codes, and that's what we need to understand. What is given in the text is never as it seems. There's a lot of decoding that has to be done, and that is what the role of a Vaidya is. A Vaidya is not just a practitioner. A Vaidya is a scientist, he's an analyst and a practitioner, and he's a social reformist as well ultimately. So these are the 4 things that I'll be covering in a gist as much as possible in this session, because these are the different dimensions in which one can approach looking at the human body or even intervening. What Ayurveda primarily deals with, and I say primarily because Ayurveda mentions about the other aspects as well, but without going too deep into it. For what purpose? So that we don't get confused as Vaidyas. Because they give us a primary perspective through which you can view the body, analyze and intervene. But they also give hints and clues throughout the text regarding the other dimensions in which this body functions. So I'll jump this because by the end you'll get a gist of it. So the 3 doshas. Of course, there's no need for me to explain what 3 doshas is to everyone. But I'm just going to run through this part so that we understand the later parts better. Why 3 doshas? There's always been a question. Ashushrutacharya mentions the 4th dosha, but we'll also see what context he explains that in. 3 doshas are ultimately 3 only for very simple reason. That these are the laws of physics, that's it. These are the mechanics that govern the whole universe. You have something that is created, you have something that's sustained, and that's something, that's the destruction that happens. And what we think of as destruction is not really destruction, it's a transformation. And that's what, mythology signifies by the ideology of Shiva. So everything that you see ultimately can be broken down into just 3 basic steps. So you might be seeing me walk around from one place to another. So it might, if I ask someone would say that, okay, you're just walking around. But if I were to take this walking around, which is a singular action, and break it down, we see that there's an initiation of the movement, there's a sustenance of the movement, and there's a termination of the movement from point A to point B. So there is nothing beyond this or below this. So ultimately everything is 3. And Vata. What is Vata? So we talk about Vata in terms of wind, we talk about it in terms of movement, but what exactly is happening? When we talk about Akasha, and I want to emphasize on this Akasha aspect very much, because this is the most focal point of emergency interventions. And I'll also explain how that plays a role in Agni Karma and Vidya Karma. So this Akasha, it's not empty space, it's not a complete vacuum. It just means a lower gradient. If I have a high value of, or say that I have a heavy object in my right hand, I have a lighter object in my left hand, the difference between these 2 masses, that becomes Akasha. And so what happens as a result of this difference? You see that the law of nature is that wherever there's an imbalance, to create an equilibrium. So if I spray, say, perfume in one corner, the perfume would diffuse throughout the room within a span of 10 minutes, because the perfume has to diffuse from a region of high concentration to a region of lower concentration. So this diffusion, this movement, this balancing which happens as a result of this imbalance is the Vayu, which is why Akasha and Vayu always go hand in hand. And just this one example with the nerve conduction in the body. Again, all of us know what happens with saltatory conduction in the nerves. But we study about it in terms of chemicals. We talk about it in terms of neurotransmitters. But what is happening at an even deeper level is that there is a flow of charge. It's basic electricity. Your bodies are conducting electricity every single second. And this is what we call as prana. And of course, the word prana has many connotations. In some context, it refers to a vital force. In some context, it refers to a mechanical force. In some context, it refers to life or consciousness itself. So that is up to you to understand what it means in each context. But in the context of Vayu or Vata, in terms of the Sukshma Sharira, the prana is nothing but the bioelectricity which is flowing and conducting through your body every single second. And it is this electricity, just like how the electricity is illuminating all the bulbs and the AC here, that is keeping the life, the tissues active and alive. So with the prana, you need the prana for the vata to function. So if I'm able to walk around and talk right now, I should have had my food. I need the energy and fuel. That energy is the prana, and the mechanism or the action, the function that I'm performing right now is the vata. So prana is the power for vata. And pitta. Pitta, again, you have two components which are apparently, totally opposite, Jala and Agni. But how do these combine together? How do they work together? In fact, I always give this example that, they're a husband and wife. You always find them fighting, but they need each other. They can't live without each other. And that's exactly what happens with Pitta. Pitta, you see that what happens is in the first Vata, you have a difference. This difference in pressure, concentration, mass, electric charge, it can be anything. This difference creates a flow, which is the Vayu. And as a result of flow or motion, if you rub your palms together, you generate heat. So there's an energization that happens. There's an activation that happens. Heat or Agni is generated as a result of it. And Agni not just as heat or temperature, but there's a rise in the energy of a particular cell, atom. You can call it whatever you want, but there's a rise in the energy state. This Agni now, the second step of what happens with Agni is that, say that I have too much heat in my body. The automatic reflex would be to take something cold and hold it against my body. The reason being that this heat has to dissipate. I have to transfer this heat out. So again, there's an increase in something and there's a need to create a balance. So there's again an equilibrium mechanism that happens here. And what happens here is that this heat or this energy then goes on to create bonds that we call as Jala. So when we talk about Jala, we're not talking about literal water. We're not talking about fluid. We're not talking about Jala in the gross, pictorial, visual sense that we think of. But in the subtle sense, in the level of the body, these are the bonds which are holding your body together. It can be a covalent bond, it can be an ionic bond, you can call it a chemical bond. But what is binding and holding everything together? Shlish Alingani. So this is why we call it Sneha. Sneham in the colloquial languages also means bond. It means love, it means affection. Because it means the same thing at this level as well. So Agni creates Jala. But at the same time, Agni needs Jala for another reason. You see that where are these energy, in the body we say that we have ATP, we have energy, we have all these things in the body which is powering us. But where is it stored? It's stored in the bonds which are holding your body together. That is why when you break a bond from basic chemistry that we have studied in our school, you break a bond, energy is released as a result of it. So Agni creates Jala, but Agni also needs Jala because it is the house, it's the Adhara in which this Agni is able to reside and stay. And finally Kapha. So Kapha here, we were talking about the bonds which are created as the resultant of energy. Now these bonds, as they keep accumulating, as the bonds keep creating, what's the consequence of this is that you have something with mass. And what is the importance of this mass? So this is another aspect that plays a very important role in emergency management. Because when you're playing in, when you're handling emergencies, there are three aspects: the Akasha, the Agni, and the Prithvi. These are the three primary factors that you are trying to work on in any emergency condition. So now, what is the difference between a physical me walking and talking versus if you had a hologram over here? If there was a hologram, it would look absolutely like me from a distance. But you go and pass your hand through it, it just passes through. There's no resistance. Nothing is interfering or impeding the movement of your hand. So what is the difference here is that my body has mass. There is something that is creating sthiratva. Whereas with this visual image, this hologram, there is nothing sthira here. So there is nothing that is holding this body together. It is just an illusion. So like I was talking about this whole sequence of Akasha to Prithvi and Prithvi to Akasha. This is what we call as Laya and Pralaya back. And where does this play a role in Chikitsa? This is what you're primarily doing in Langana and Brahmana. In Brahmana, you're working from Akasha towards Prithvi in understanding which stage to intervene at and what to work on. And likewise in Langana, from Prithvi, you understand how to create it back to Akasha. But the most important part is to know at which stage is the pathology at. It's never a fixed standard. That's the beauty of our science. It gives us all these guidelines as to understand and know when to intervene. So this aspect is the gross mechanics of the body that I was talking about. This is the functional dynamics. So this is with the doshas. The three doshas are entirely functional in nature. And like I said, what is powering these functions are the three subtle energies in the body. So like I said, with prana, prana is the power for vata to function. Similarly, for pitta to function, you need tejas within. And for kapha to function, you need ojas. So what is this prana, tejas and ojas? My Siddha guru, he used to explain, in Siddha, the terms are the same, vata, pitta, kapha. So I used to get very confused, with what exactly is he talking about. But there's a very interesting thing in Siddha. In Siddha, they have an exactly opposite sequence of the doshas as opposed to what we study. We study that kapha comes in the first part, pitta in the second, and vata is in the later part of life, day, or can be of any sequence. In Siddha, they study the exact opposite. That vata comes first, then comes pitta, and then comes kapha. So this seems like a big controversy, and in fact, this is the biggest controversy that divides the Siddha community from the Ayurveda community. So they claim that they are right and we claim that we are right without understanding that we are talking about two different substratums of the human body. They are talking about prana, agni and ojas. They are talking about this sequence, especially when you get into the yoga shastras and the tantra shastras. There is this understanding of the vajrakaya, vajradeha. And this vajrakaya or this vajradeha is not something that develops as soon as you're born. You learn, your body has its own physiology. And you also learn, if you practice yoga, how to convert prana into ojas over the duration of your life. And what is the medium of this conversion? It is Agni. So we are talking about two different substratums of the human body. And this is not just theoretical, this is not just philosophical. These are very practical aspects of intervention and treatment. So we all use, parada, we use gandhaka, we use, copper, we use tambra, then we use swarna. But where and what is the context of using each of these dravyas? So, in Siddha again, when I say Siddha, we are talking about Sukshma Sharira, we are talking about the yogic aspect of looking at the same human body. There is this concept of the whole physiology is understood on a different basis. It's understood on the basis of Ida and Pingala. And this is something that I practically use in my practice as well. So many of the cases or the emergency cases that come to my place, because it's a rural area and for around 8 villages there, the government hospital is at a distance of 10 kilometers. So everyone knows that the service in the GH is very poor. At least I'm being very honest about the state of the government hospitals in Tamil Nadu, the allopathic hospitals. So people hesitate, consciously they hesitate to go to the government hospitals. So even if there's an emergency, they rush to the local physicians or whoever is a reliable or a known person. So a lot of cases, stroke, the brain stroke cases, they happen to come. And my basis of diagnosis is this, so according to allopathy, you need to do a scan to know if it's an ischemic or an hemorrhagic stroke. And because the signs and symptoms are almost the same unless the swelling is extreme. But by looking at the nadi and by understanding the pathology on the basis of Ida and Pingala, you can understand if this is an ischemic stroke or an hemorrhagic stroke. And your intervention will change accordingly. So here, the whole concept of using medicines and diagnosing in emergency conditions is primarily on the basis of, is this Ida, is this Pingala? So when I say Ida and Pingala, what are we talking about? This corresponds with the prana and apana in a very different sense from what we study. The prana is the input of energy, the body's ability to draw energy within, and the apana is the body's ability to push out any pressure, vayu. It's an anulomana gati. So there are two aspects that keep the body active and alive. And this is what we call as the Ashwini Kumaras. The Ashwini Kumaras are nothing or nobody else but these two vayus within your body. And only when these two are balanced, we say that the Sushumna Nadi, or again we call it the Samana Vayu, which is in a different context, it begins to function. So the simple example I always give is that you take a car. The car is not going to run without fuel. So it needs prana. And you try blocking the exhaust of the car, again it will not run. So the function of the apana also has to take place for the engine in the car to function. So these are the two most important aspects in an emergency condition. And as we go, we'll get deeper into it. So here, I'll just give a little gist here. So what Parada does is that it works on this principle of Akasha. It creates space. Whereas sulfur or Gandhaka, it creates a push. So what is the difference in both of these things? So when we take a case of stroke, I'll take the example of an ischemic stroke. So now what happens in an ischemia is that we all know that there's a clot that's blocking the artery inside, and that is creating a deficiency, or there's no blood and oxygen reaching a particular lobe of your brain, and this is an emergency state. So here, allopathy basically says that the blood clot is a problem, and I need to give anticoagulants to dissolve the clot and ensure that the blood flows through. But what we don't look beyond is that the clot is the secondary factor. This clot was traveling throughout your body all this while. It definitely was not generated and created in the brain itself. So it was moving for a while until it got lodged in one particular part. So why did it get lodged here? It's simply because that the vessels there are merely too tight. There's a stambhana which is occurring. So all I need to do is, in an emergency, I can either go through, I can work on dissolving the clot, which might take a while, or I need to just instantly dilate that artery and the vessel, which will dislodge the clot. That's all. That's how simple the intervention is. And so what we do is, when it is diagnosed as an ischemic stroke, all we do is a simple shirodhara, and that immediately clears the clot and the person gets up and walks. And there's nothing more that you need in an emergency situation. So we'll save the claps for the end, it's okay. So the problem, so what we do here is that what we are looking at is Shroto Vivaranam. And what we use here is a simple Tailadhara. If this was a hemorrhagic stroke, I need to do the opposite. I need to go for a simple Takradhara, because I need to do Stambhana instead to arrest the hemorrhage which is occurring inside. So a simple dhara can work such wonders. It's not just psychological, it's not just relaxation, it's not for just the brain. It works on each and every part of your body. I had another patient, and I really respect the Muslim community in one particular aspect, that the Quran mentions that surgery is prohibited. So these are the best patients who comes to us, because they have such faith in us, and also, over their own body. Our immediate resort is, okay, I have a problem, let's remove it out. But they respect, that, okay, this body is God given by, it's a gift from God, and I don't have the right to cut open and, play around with it. So I had another patient who came with a strangulated hernia, another condition which is basically indicated for an emergency intervention. You need to do surgery to, remove the sloop or unstrangulate it. All I did was a simple dhara over the nabhi. It was an umbilical hernia, and again a thaila dhara. Within 10 minutes, she said that she had a sudden jolt of twisting. It wasn't a pain, but she could feel something twist inside. And the very next second, her sweating, pain, everything it completely vanished. And what had happened, I had sent her back. She was first diagnosed with the strangulation. And because they went to a local physician in their area. They live 2 hours away from where I am. And the local physician said that get a scan done. The scan said that there's a strangulation. So then she came over here because she didn't want a surgery. We did this. Then after that, just to ensure that, okay, let me see if the strangulation is gone, I asked her to get a scan done. And I was shocked because that was the first time I had handled a case of a strangulated hernia. And I was really surprised to see that something so complicated, it unknotted on its own just with a simple dhara. So the dhara, it's not just a dripping that you're doing. It works on 2 levels. And we'll look into this 2 levels. So before I get back to dhara, so you have this parada, you have the concept of akasha and agni. And this is the fundamental concept behind Vidya karma and Agni karma. So wherever you feel that the shrotas is blocked, there's a block to the flow of prana, you need to induce akasha to allow for the prana to flow again. That's where you go for Vidya karma. Wherever you feel that there's an excess pressure and a blockage. And where do you go for Gandhaka or where do you go for Agni karma? So wherever you feel that now, the shrotas is patent, but the flow is absent. There is nothing stimulating it. The pressure, the anulomana gati is absent. So there you need to give an extra push, and that is where you go for Agni karma. So they have these are the primary principles behind where you use Agni karma and Vidya karma, and many of the Ayurvedic principles as well. So this is in fact the concept of Panchaloha, and where and when we use these Panchalohas in an intervention. So where the prana is not flowing or the prana is completely absent, you go for Parada. Where the prana is present but the anulomana of Vayu is absent, you go for Ayas. Where you feel that the Agni is absent, and when I say Agni, it's the active state of the body's tissues, you go for Tamra. And now you feel there's excess heat, what we call as Dhatu Paka happening. But at the same time, I cannot give something Shita because this might cause further stambhana and weakness. So there I go for something like Rajata, which absorbs the heat, but it converts it into Jala. So Rajata has this property that it does not, there's a difference between using Ayas, which is also Shita, and Rajata, which is also Shita. Ayas it will absorb the heat and dissipate it out. But in case of Rajata, where the dhatus are already in a very weak state, this dhatu shaitilya, I cannot afford to cause further depletion of the Agni in the body. So this heat that I think is an apparent heat, it is merely caused by an accumulation of pressure. The Vayu's movement is not flowing, and this is generating a pressure and heat. So I need to convert this heat into Jala to strengthen the body. So that's why we go for Rajata. And finally Swarna. Why do we use so much Swarna in all of the emergency conditions? Is because there are 2 types of emergencies. There are basically 3 types. But these 3 types can be broken down into 2. One is what we call as acute. So in the acute condition, you have the Vayu which is not able to flow. There's a blockage. And the second cause is that there's a high pressure. Basically there's too much Pitta, too much Agni, and this is causing the dhatus to explode, which is what happens in Rakta Pitta primarily. So these are the 2 conditions of acute. Whereas in chronic acute, what happens is you have these 2 accompanied by the 3rd factor, which is dhatu shaitilya. Your shrotas are completely debilitated and weak. They don't have any bala. So now how do I intervene in a condition such as the 3rd one, where there's chronic acute? The dhatus are weak. So if I create further movement of Vayu, that Vayu would push all the Vayu out. The person might collapse. I cannot give further heat. I cannot give further Agni because that might cause Dhatu Paka and the person might again collapse. So then comes the solution of Swarna. Swarna works on the principle of Ojas. It is Ushna and Shita. So what do we mean by Ushna and Shita is that it's not hot and cold. It means that it gives tejas while also giving dhatu bala. So the word Shita here is a connotation for bala, something which is brahmana, and that is done by swarna. So it's the best medicine to give in a condition when you feel that the dhatus are completely collapsing and you want to create a flow of prana and restore the agni of the tissues once again. So when we look into the mechanical aspect of what is happening in an emergency, there are 3 stages. That's what we study all of this in our first year, Padartha Vijnana. But its implication is so deep, Dravya, Guna and Karma. It's as simple as that. The first is karma. Whatever pathology occurs in the body, it begins with the first stage of vata. So the karma, the function, something that cannot be diagnosed by your lab scan or it cannot be diagnosed by your lab test. Neither of this can diagnose what is happening with vata because it's entirely functional, it's mechanical. It's a mechanics of the body inside. And the second stage that this progresses to is the stage of guna. And this is where you do a lab test, you will understand, okay, these chemicals are out of balance. This is where pitta is affected. And the final stage is when the dravya itself gets affected, which is what we call as the dhatu shaitilya, which your scan would definitely tell you. You do a MRI, you do a CT or you do an X-ray, you understand the status of the dravya. But what cannot be understood ever, except by an Ayurvedic physician, is the status of the karma that's happening inside. So now, jvara. And this principle of jvara is what applies throughout the entire Shastra. Whatever you're studying at each of the level of the dhatus, rasa, rakta, mamsa, meda, asti, majja, shukra, it's all jvara. So Acharya Charaka gives us a wonderful clue. I didn't include a slide here. But when he talks about the 8 diseases in Nidhanasthana, you find that Chikitsasthana has 30, but Nidhanasthana has only 8. If you have ever wondered why, he gives us a clue. That these 8 is nothing but jvara occurring at the level of rasa, rakta, mamsa, meda, asti, majja, shukra, and finally ojas, which is what we label as, jvara. Used to label it as rakta pitta, gulma, then prameha, kushta, shosha, unmada, and apasmara. So if we go deeper, it will become a session on nidana, so I'll avoid that, but it is basically jvara occurring at each of these dhatu levels. And this is what is the principle of the entire chronic management or acute management. So what is happening in jvara? We talk about the Agni Bahir Niryasya. The Agni gets displaced from the koshta towards the periphery, towards the shakas. So now is it the Agni, is it some liquid pitta which is dissolving and spreading through the periphery out to your koshta? No, it is something beyond that. So now we will take the example of this auditorium. You see that you have the AC here, and this AC is keeping everything cold. Now we'll just imagine the opposite, that this is winter and there is a room heater which is keeping us all warm right now. So now what happens is, this room heater, since it's keeping us all warm, we have left the windows and doors open for a little bit of ventilation. And this is the status of the body in a normal state. Now say that the heater stops working. What do? How do you retain or restore the warmth or the temperature in the room? You shut all the windows and doors, because this is your second option. Because the heater, central heater is not working, I have to resort to this. And this is what happens in jvara. So what is happening is, because the Agni, due to multiple reasons, if it is a vata person, if it's a vata prakriti or a vata vikriti, what is happening is there's rukshatva that is causing stambhana of the koshta here. And this koshta is primary to the understanding of Ayurvedic pathology. So that's why we have 3 levels of Agnis, which I will also cover. So these 3 levels, the primary level being at the koshta or the jatra Agni. So what is happening with the jatra Agni? What is the pathology here is that the movement, what we call as vata-anulomana. We talk about vatas, anulomana as something that moves from up to down. We just think of it in such a gross manner. But vata-anulomana means that there is a constant movement of each and every tissue and cell in your body. In fact, there's a science called osteopathy, which says that even your bones are moving right now. We think the bones are the most immobile structures in the head and in our body. But right now, the cranial bones though they are connected by the sutures, there is a slight movement, a slight oscillation that keeps happening. This oscillation or this movement is what is keeping everything active, alive, and moving and dynamic within your body. If this oscillation stops, then that's the second that the heat or this Agni, the Tejas, stops to be, it stops being created in your body. So now, what happens in Jwara is that this Koshta, it undergoes Stambhana. The second it undergoes Stambhana due to either Rukshatva or Pitta's Ushnatva, which causes Kleda to accumulate inside, or it can be due to Kapha's Gurutva, which is causing a Mandatva of the Koshta inside. In all three cases, the Koshta becomes immobile. Without this mobility, it's not able to pump. And this is why they give us the example of Samana Vayu and Pachaka Pitta. They don't use any other example. They don't say that you have to blow. They don't say that you have to blow air to generate the fire. They say that you have to pump a bellow. Why did they not use any other example but this? Because this is what is happening in your body. Every tissue and every cell is pumping and contracting inside to generate Agni. And this is what we call as Vatanulomana. So the moment this pumping, this contraction and expansion can be of your koshta, your heart, can be your liver, kidney, each and every cell and big organ in your body is constantly pumping and contracting and expanding. So this is what is keeping the Vayu active. If this gets arrested, then your body's next mechanism is to close the Shrotas on the periphery to once again generate this heat in order to do Shroto Vivaranam. That's as simple as it. So your body is closing up the Shrotas to generate the Tejas once again to open up all the Shrotas which has undergone Stambhana. This is the basic pathology of Jwara, and this is what is happening at the level of each of the dhatus that we study as the Ashta Sampraptis of Charakacharyas. So it's based on the basic concept of thermodynamics. So in thermodynamics, you take this human body. We have four basic cavities. You have the cranial, you have the thoracic, you have the abdominal, pelvic. And this is where you have the four mechanical vayus: prana, udana, samana, and apana vayu. And finally, vyana, which is moving throughout your body. So what is determining the state of this vatas in your body is basically that these are compartments. Just like how you have intraocular pressure, intravascular pressure, each structure has a set amount of pressure that it can withstand according to its bala. The pressure exceeds or the pressure reduces, both of it results in an emergency condition. If it exceeds, the dhatu breaks. If it reduces, the dhatu collapses upon itself. In either case of which, the vayu's movement is arrested and life is lost. And this is based on the basic principle of thermodynamics. So the second phase, which is the most popular concept here in Maharashtra, is the whole Kshara Amla Dharma that I've always heard of. So this is what happens in the second stage. And what is happening here is once the function gets altered, and it can be any chemical, it can be your bile, creatinine, uric acid, whatever it might be, ultimately what's happening at the level of an Ayurvedic chemistry mind is that it's a basic imbalance between Kshara and Amla. And very interestingly, when you take all the cases of shock, what is considered as, all these are emergency conditions, you'll find that the underlying mechanism at the level of the chemistry, Pitta, which is the secondary stage, is that there's an acid-base disturbance. And this is the principle of Vishachikitsa. And this is the relevance of Vishachikitsa in all other emergency conditions as well. Because what's happening in Visha is that we study that Jamgama Vrisha and Stavara Visha are antidote to each other. So what is the principle of this? When you look at all the Stavara Visha, Jangama Vishas, they're basically acidic in nature. And when you look at all the Stavara Vishas, you'll find that what is mentioned is that these are rich in alkaloids. And when you look at the definition of what an alkaloid is, it's basically something that works like alkaline. So what is happening at the level of Visha, it's basically just that it's an acid, an alkaline counterbalance. And if you understand this principle, it doesn't just apply in the context of Visha, but it applies to each and every disease. And that is why a yoga such as Bilvadi Gutika has a multi-spectrum, application, not just in Visha, but in Jwara, it can be in Rakta Pitta, and it can be in any sort of condition. as long as you understand that what is happening at the underlying level is that there's an increase in the Kshara Guna, and I have to give something which is, Amla Guna, and I have to give something which is Ksharya to counteract it. Now, what if it is something which is Ksharya in nature? What if the alkaline level of the body is high? Then I go for Visha or Visha Yogas, which are Amla Guna Dharma predominant, such as Jangama Vishas. So these are little aspects regarding to prana, getting into the subtle concept of what happens with the dhara or what is happening with the level of Vidya karma. So there's something known as piezoelectricity.
Did you know electricity can help heal wounds faster? The skin's natural regenerative process includes 4 stages: hemostasis, inflammation, proliferation, and remodeling. Researchers found that skin cells are electrostatic, meaning they migrate directionally in electric fields. By placing a wound under an electric field, it healed 3 times faster than usual. This method also shows promise for chronic non-healing wounds, like those experienced by diabetics. With continued research, customized stimulation based on individual wounds could make chronic non-healing wounds a thing of the past.
So this is why we find mantra chikitsa mentioned in Vrana. And it's because mantras are not just sounds, it's not just syllables. You're generating this prana. And this prana has the ability to restore or reset the body's capacity to heal itself. And it's not just in this context, it's even in the context of dhara. So in dhara, when you're doing a shirodhara, you're not just opening up the shrotas, allowing for the vayu or the clot or anything else to move, but you're generating basic piezoelectricity, which can restore the function of the lobe, which had probably not been getting its prana or oxygen for how much of a duration. So if the person had been under this effect of a stroke for say 2 hours and that lobe has ceased to function, your dhara is not just going to clear the clot, but it can restore the function of that brain lobe. And that's what they do in shock therapy. That's what they try to at least do in shock therapy for psychiatric conditions. So here's the concept of pyroelectricity, which is using heat to generate prana. And this is what you're doing in Agni Karma. So your Vidya Karma is you're relieving excess pressure, and in Agni Karma you're creating pressure to create a flow of the prana. So this is Jwara and little deeper things. So in Siddha, my guru gave a lot of clues regarding how to understand which yogas to use in which context. So what we call as Karpu is nothing but the Kajali yogas. What we call as Sinduram are the Sinduras. And Chunnam is very unique, where these are preparations which are highly alkaline in nature. So they are a stage beyond Basmas. So it depends on your diagnosis again in an emergency condition. So if you diagnose a person to be lacking prana, if you feel that the person's tissues are dying out, they're not receiving ample amount of prana, you go for the Kajali yogas. So we have medicines such as Shivanar Amritam, which is the exact same formula as Shwasakuta Rasa. And you have Shimanamana Rasam, Karpu Vishnu Chakram. The context and application of each of this will differ based on the pathology. But you understand that all of these are medicines or class of medicines that give a surplus of prana to the body. It's like giving a shock treatment. The Sinduras are medicines which you apply when you feel that the Agni, the Dhatu Agni is collapsing in the person's body. And again, you have a different class of, different sets of Sinduras. And the Chunnam are the medicines which we use when you feel that the person's ojas is collapsing. So in case of Ojo Vyapat, Ojo Nasha, the Chunnam medicines are the ones that we apply in those emergency interventions. And these are again other set of medicines that we use in each different context of emergency. Your Potali is, these are the bandhanas. So we have a different set of yogas in Siddha called as Kattu. Okay, I'll explain this in the end if we have time. So Kattu is a little different from Potali. So what is the difference is that here we convert metals and minerals into crystalline lattices. So what is the benefit of a crystalline lattice is that you're converting something which is a visha into something which is highly rich and as capable of supplying a person with prana, Agni, or what we call as Tejas, and Ojas. So these are last minute interventions when you feel that the person's prana is absolutely depleted, Ojas is depleted, Agni is totally absent. How do you bring back a person whose all these 3 factors are collapsing? we go for the Katti yogas. So this one that you see here is Haratala. We call it Pontalagam, which is golden Haratala. So what I've used here is the Drona Pushpi, not the Pushpa, but the bud of it. So we crush it, you put it inside the coconut shell, you light a lamp under that. You do this for 3 continuous days, 12 hours each, and you get a crystalline lattice that can be used in, again, any sort of emergency involving the pranava shrotas. Then this is another type of medicine, which is a chunnam. What we have prepared here is Gandhaka chunnam. And we have used something called as Nellikai Gandhakam or gooseberry Gandhaka for this particular yoga. And when we come to Varma intervention, Varma's understanding of the body is, again, it's on a different spectrum. We see the body on the basis of 10 nadis and 10 vayus. 5 assisting vayus other than the 5 pradhana vayus that we study about. So in Varma, you have techniques known as Adangal. So you have tried medicines, you have tried everything, and the person's still not resuscitating. So now what do? There are 2 methods. One is Adangal, one more is Thiruvukkol. In Adangal, now Adangal methods are very similar to Rakta Mokshana. There's excess force of Vayu, which is constricting the function of a particular organ inside. You need to relieve that pressure. You do an Adangal, which arrests the gati of the Vayu. And in Thiruvukkol, you are resuscitating or you're creating a flow of prana to something that is completely lacking it. So in Varma, we have these 2 techniques to resuscitate a person. So these are all the different Adangals that we have. And these are few Varma-based medicines. So Varma's concept of giving medicines is also very different. The basic concept in Varma in an emergency is that I need to use herbs which are rich in prana, which will go and clear the blockage in the nadi. If the function of the nadi is restored, the person wakes up and the doshas begin to function once again. So we used Mandukaparni, and I couldn't find the Ayurvedic name for this. We call it Veli Paruthi. So these are 2 common medicines that we use in most of the Varma-based internal and external yogas. And there's another method known as Kudori Marutvam, which is Kutarika. It's very similar to Sira Vyada, except that here you do the Vyadana with the Kutarika, after which you apply medicines over the site. And this is used in, again, emergency interventions, not just Visha, but in case of Murcha. So Murcha is not mentioned here. So when we talk about Murcha, it basically applies to all of the stroke conditions as well. And the concept of prana pratyagamana. So we need to understand this. It can be due to Visha, it can be due to internal doshas. There are 3 modes of intervention. So what we do with mantras is that you're arresting the gati of the dosha or the Visha. That's where mantra chikitsa works. And what we study in the classical Ayurvedic text is the second one, which is Visha or dosha viparita chikitsa. Now you have the third modality, which is once the person's vital signs, everything is gone, a person is declared dead. Within 6 hours, there are a few tests that can be done. One simple test is that you can lay the person down and pour oil into one ear. If the person is dead, completely, the prana has completely left the body, you'll find that an oily substance comes out through the other ear. So this is not the oil, this is what we call as the Devadattan Vayu, which is dissolved inside. If the person is still alive, the oil which you put into one ear, it will remain inside for more than 5 minutes. So then you know that, okay, I can resuscitate this person. And a very simple fix is that it's very available. You can grow the seed, you can collect the seeds and grow this in your houses. Black Datura. The leaf of black Datura is crushed, 3 drops into each nostril, and the person will definitely wake up if the signs of prana are still present within his body. But when you play around with such aspects, there are other factors to be looked into as well. So this comes into the concept of karma kanda. So you need to know that even though you can intervene, whether you should intervene or not. Can is different from should. So this is ultimately a summary of the whole multi-spectrum approach. Chikitsa is of 2 types, Langhana and Brahmana. We call it Shiva Shakti, you can call it Ida Pingala, you can call it Prana and Agni. So this is why most of the Rasa Yogas, they have the 2 base ingredients of Parada and Gandhaka. You correct the Ida Nadi and the Pingala Nadi, automatically the body is capable of correcting itself. The Sushumna or the Ojas is awakened within. Then Parada, Gandhaka, Kshara, Amla, Stavara, Jangamavisha, Vidya Karma, Agni Karma, all of it falls in this bilateral classification. And again, this is just a gist. How Dvivida becomes Shadvida. But I'll not go to it. I'll avoid this. This I wanted to mention because I'm in the land of Agni and Vidya Karma. And from whatever texts, references, and talks that lectures that I've gone through, I've seen that there's a lot of mention regarding the points and the conditions. But there is something known as the human circuit, the map of the body. Why do we use particular points, and when do we use particular points, in which avastha, which stage, and what condition? So Sovarikpa is one wonderful science where they've unified Ayurveda, Siddha, and these concepts of Agni Karma, Vidya Karma, Rakta Mokshana. In fact, this is a very good book that I would also recommend, which is a Sovarikpa book that maps the entire circuit of the body and tells you when to do Agni Karma, when to do Vidya Karma, when to go for Rakta Mokshana, and how each and every organ and structure in your body is connected to which Sira, which Nadi. And so you have an idea of what is happening at an underlying level when you're performing these methods. And finally, just a little note that it's not always about prescriptions. It's not always about just, okay, that this Vaidya is using this medicine, so it's going to work for me. It's about understanding each of these Vaidyas, the great Vaidyas that we have here. It's because they have understood the foundation, the basic principles, and they've expounded on it, and they've learned when to use what in which context. So that is what we call as yukti, and that's what makes a Vaidya great. And that's what I would also like to emphasize on.
I think this is one of the most unique lectures that we've listened to today, and I think everyone will agree. Thank you so much, Rishi sir, for that insightful lecture.